I'm Dr. Terrence Poole and my associate Dr. Bell. We're glad to be able to do a little presentation for you, and for Closing the Health Gap, we appreciate them putting this out because we think it's pertinent information. I have a practice in Kenwood. I've been in practice for 36 years. Ironically, we're in this pandemic, but I was also in practice in San Francisco in the dental school at the end of my dental school career during the HIV episode, and also the infections that were traveling around the country, and actually initially where that was all started. So I'm kind of a veteran in this situation. I have Dr. Bell here as well, and he will give a little bit more information about himself.
Hey, how you doing? My name is Dr. Shawn Bell. I am a native of Cincinnati, Ohio, graduate of Meharry Medical College, and did residency at Ohio State University. Been working here with Dr. Poole for about the last 10, 11 years, and just great to be back in Cincinnati and providing oral health care and making lasting smiles. Well, COVID-19 is a disease or virus that usually affects the respiratory system. And those with underlying conditions can often have more severe symptoms. So staying on top of your overall health is extremely important, and that includes your oral health. One thing about underlying conditions, or some of those oral underlying conditions that can cause severe symptoms when you have COVID-19, some of those things sometimes have oral manifestations. So making sure to, go to your dentist regularly, as part of your overall health, is very important in maintaining your oral health.
Dental offices have been mandated, and we have all taken a lot of information in from the ADA, from the CDC, to make sure that the dental environment is safe for our patients. We as dentists don't want to get COVID-19 either. So we are make sure that we are taking all the steps necessary to protect ourselves as well as our patients. And when you go to the dentist, you will notice things have changed. There's not a lot of people in the waiting room, and there shouldn't be. If you go to a dental office and there's not social distance, you need to go to your car and have them give you a call when your appointment time is there. As well, as you may notice, air purifiers and as well as dentists have done things to purify their air and make sure that the transition between patient to patient is acceptable. As dentists, we have always taken infection control seriously. We've always had autoclaves. We've always been right there in the mouth, so we're used to the infection control. We just now have to take a little bit more care in transmissions that we're concerned about from patient to patient. When you go to the dentist, you should see the difference as well in your temperature should be taken. There will be a questionnaire. Don't get frustrated. We have to ask everybody the same questions. As well as your dentist should kind of look like Dr. Bell and I, with the exception of a shield. And you will see now dentists wearing a face shield, which will probably stay around for perpetuity from here on out. Dentists will also have some type of protective clothing on, as well as gloves, which we've always had. In dentists, we've always had masks and we've always had glasses. So those are some of the things that you would notice new in the dental office. But don't be afraid to go to the dentist. There has been shown that dentists have had 0 to less than 1% of any kind of transmission in the dental office as well. So we are safe. We are here for you. We are here to treat your dental needs, and be assured that we are taking mostly all precautions.
Absolutely, you should visit your dentist. You want to maintain going to your dentist to prevent things from getting worse, or to just stay on top of your oral health so certain things don't happen. Some of the guidelines they should follow just during these times is you want to make sure to have your mask or facial covering. You want to make sure to always be aware of your physical or social distancing. And you also want to make sure that if you do start to feel symptoms, or if you feel as though you've been in contact with somebody who may have been positive or been in contact with someone who's had COVID, to call your dentist office to let them know so they can take the necessary steps, which is most likely getting you rescheduled at a safer time for you, the office, as well as other patients.
The best and the smartest way to prevent dental problems during the pandemic was to have regularly visit your dentist prior to the pandemic. Well, that's not always the case. However, if you have dental problems or have some concerns that may be arising during the pandemic, the best thing to do would be to call your dental provider. A lot of you don't have a regular dental provider, I would call the Cincinnati Dental Society or call your insurance company and they can recommend a provider for you. But some of the things you can do is to brush, as all dentists recommend, twice a day, morning and night. There is recommendations now to do a mouth rinse. If you can buy an over-the-counter mouth rinse with a little hydrogen peroxide, and that tends to help kill any bacteria that enters your oral cavity. COVID-19 is a virus. We do show that peroxide does prevent some antiviral effect. It's not a cure and prevent you from getting COVID-19, but it will help you keep your oral cavity clean.
Facial swelling is definitely probably one of the number one signs. Persistent or worsening pain over a shorter period of time. Pain when chewing is definitely another sign. Or even excessive bleeding from the gums is another good sign. You want to make sure that you try to get in to see your dentist as soon as possible, because some of those things can be treated with something as simple as a filling, or if we need to do a more complex treatment or a more in-depth treatment such as a root canal or extraction to help to get you out of pain or to help fix the situation.
During COVID-19, we have noticed an incidence of stressful dental-related conditions, some of which we can cause pain. And we have noticed that, and in the dental literature, we have seen this, that there's an increased number of patients coming to the office complaining of fractured teeth, fractured fillings, tight jaws, soreness in their jaw, and it's all related to stress. We're all kind of been quarantined with children at home from school, with people at home from work, Zoom calls, tend to increase anxiety levels. As a result of the anxiety level, we're starting to see a lot of people grinding their teeth and clenching their jaws. Muscles get tired, teeth fracture, teeth break, fillings crack. So as a result, we're seeing root canals that we have to do, extractions, redo fillings, and redo crowns. To remedy that, we really now are suggesting that you have a mouth guard. Some of which you can get over the counter to determine if that might be the root cause of your pain. But we are doing custom mouth guards which stay in your mouth at night, and insurance companies have been pretty amicable about paying for those. So if you do notice that you're having pain, which is unusual, that you never really had pain before, you don't really have problems with your teeth, call the dentist, and that may be a cause of what your pain may be stemming from. So the other thing to help alleviate the stress is to make sure you get out, walk, exercise, read, do a little yoga, some stretching. All of those things can really help reduce your anxiety, which in turn will help reduce the stress in your mouth. Dentists do have access to the vaccine. They did in Ohio and in most states move the dentists up to Tier 1A, which was the first line of treatments after the emergency room nurses and the ICU nurses and doctors and the nursing homes, skilled nursing facilities. So at this point, even in Ohio, we have had access priority to the vaccine up until I think next week. So let's talk vaccine in the African American community. So I'm older, I'm 62, I'm not gonna shy, and most people my age and older were a little leery of science and leery of vaccines because of the way African Americans were treated in the healthcare system years ago. But younger than me, your children have all had vaccines since they were starting school, because you didn't have the vaccines, you could not get in school. This vaccine is similar to the vaccines that your children has got. The measles, mumps, rubella, MMR that everybody knows about. The vaccines have been developed, we believe, pretty safely. I have had my initial shot. And the vaccines have been developed quicker, but everything's quicker in 2020 than it was in 1960 and 1970 and 1980. Just think, I can do an implant in 15 minutes nowadays when it used to be a big surgical procedure. So don't be too leery of the vaccine side effects and what you hear in urban myth. I would stick to the science, and I know that people are waiting a little bit of time to determine how some of their friends or colleagues have responded. Dr. Bell will tell you a little bit about that. The elderly were the first to get the vaccine, and millions of people who are 85 and 90 and older and frail with lots of medical problems have gotten the vaccine and have done well and have not shown many side effects. I don't think in the United States we've seen anybody die from the vaccine at all. And these are patients who would have died from COVID for sure. And more importantly, especially in the healthcare field, the soon employers will be mandating the vaccine. Not right now, because everybody is kind of waiting for this it's still emergency use, making sure that everything's safe. And we don't want to put a lot of pressure on people. Everybody's stressed as it is with grinding their teeth. So what we do want you to know, what I would like you to know, is that soon it's going to be essential that you have the vaccine. Dr. Bell will give you a little bit of experience about what he has had his vaccine, and maybe give you an as well, and talk a little bit about the side effects that some of the people around him and in his facility and where he's working with us as well can tell you what they've noticed.
Yeah, so I too have had my initial vaccination shot for COVID-19. And my personal experience, I experienced mild symptoms, just like if you were to get a flu shot. Arm tenderness or muscle tenderness were at the injection site. Some muscle tenderness slightly radiating outside of the injection site. But outside of that, I mean, it was very mild. I do know several people, associates, friends in the healthcare field who have also gotten the vaccination. And it seems to be that they have all had very mild symptoms as well. Some of those symptoms can range from, the tenderness at the vaccination site, a slight fever, a slight headache for maybe a day or two afterwards. Most of them were about a day. They got some rest, and then they were back to 100% or back to normal. So that's been my experience, and the people that I know personally or am aware of who have had the vaccine.
So, which Dr. Bell is saying, one day of a headache and a chill beats being put on a respirator.
Yes.
So, I know there's some people who are leery, but you got to think about the other people. I know you want to think about yourself, which of course you should, but you also have to think about everybody else, and you have to think about your relatives and your friends. And as soon as we get this vaccine, and the majority of the population is, Dr. Fauci says, that we can kind of take this mask off and all hang out again. So we'd like to thank Closing the Health Gap for allowing us to speak on the dental issues that may be facing people during COVID-19 pandemic. Hopefully we won't have to use this video again. But thanks a lot. Appreciate it.
Thank you.